So smoking cessation is fundamental part of treatment of COPD, but not only for COPD, right? Because cigarette smoking is a primary cause of heart disease, of strokes, of cancers of all types. So it's a fundamentally, in fact, I think that smoking is at the root cause of the biggest killers of Americans. Is at the root cause of heart disease, cancer, stroke, and COPD. So there's been a big push over the last several decades to drop smoking rates in the country, and fortunately, in the last 3, 4, 5 decades or so, smoking rates have dropped from about 40% to about 20% in the country. Now, how has this happened, right? So this has happened in part because some patients are able to stop smoking on their own. They just need to learn or hear that it's contributing to their adverse health or contributing to health problems they're having, and then they're able to stop. But for patients who are unable to stop on their own, there are actually now several effective treatments that are available. The oldest treatment option is what we call nicotine replacement, and those are patches that people can wear in which nicotine, which is one of the things that you get addicted to when you smoke cigarettes, is the need for you to have nicotine in your system. So this gives you a way to get nicotine into your system without smoking, and because smoking has so many other things in it beyond nicotine, the toxins that actually cause cancer, for example, that if you were to replace the cigarette smoke with nicotine, this allows you to get nicotine in a way that is safer than smoking, and allows you to eventually wean off the cigarettes completely and stop using the nicotine patch as well. So one is nicotine replacement, and there's gum, there's patches, there's lozenge. There are many different ways in which that can be given as part of smoking cessation. And then there's two other options, including what we call Zyban or bupropion, which was originally used as an antidepressant but now has been shown to be helpful in getting people to stop smoking. And then more recently, a couple, 3 years ago, a new medication was approved called varenicline. It's called, or Chantix. And that's also been shown to be effective. So the good news is that now, with these various treatment options, including nicotine replacement, bupropion, and varenicline, with counseling. So people still need help, learning about ways in which they can prevent cravings, prevent withdrawal, and prevent relapse. That with counseling, approximately 1 in 3 people can stop smoking long term. And for the rest of the folks that have difficulty stopping smoking, even despite taking these medications, the good news is that it's never impossible to quit. And often smokers need to go through several cycles of treatment, and eventually we can be eventually successful. So in summary, I would say that there are many treatment options, and not all of them are effective right away in individual patients. But if you get help from experts in smoking cessation, and you take medications to help you quit, that it can be very successful and get you off of cigarettes.
For someone who has smoked for a long time, for decades, is there still a benefit to quitting smoking after all that time?
Absolutely. So smoking cessation is not only important to prevent new disease from developing, but also it's important in preserving your health after you've developed a disease related to smoking. So for example, we now know that if you have heart disease, and in large part and you're a smoker, that even after you develop heart disease, if you stop smoking, you can reduce your risk of death from heart disease, you can reduce the risk of hospitalizations and need for more intensive care. So people who have developed heart disease, smoking cessation is still the right thing to do. We also know that for various forms of lung disease, including COPD, that smoking cessation is important because it stops the progressive loss of lung function that occurs if you're a smoker, and can actually reduce your risk of death as well in that case. So it's never too late to stop. The other thing that we know is that even if you're unable to stop smoking completely, even if the various treatment options we're talking about just allows you to cut down the number of cigarettes you smoke, if you will, that too is helpful. So you shouldn't consider yourself a failure just because you're unable to stop smoking completely. If you can reduce the number of cigarettes you're smoking, that's a big deal, and that's a value to your health, and that's on your way to stopping smoking completely.